So in this video, we're going to talk about how labor is medically induced. Now, the risks and benefits of a labor induction often depend on the method you choose to induce your labor. So there are two main types of a medical labor induction. There's induction using tools to physically dilate and open the cervix. This is often called a mechanical induction method. And the other type of induction is using drugs or medications. And then sometimes these two methods can also be combined. Inductions using physical tools to mechanically open the cervix are typically less effective but carry fewer side effects than drugs. On the other hand, inductions using medications or drugs are typically more effective, but they have more side effects because it's a medication going into your body. Another important thing you need to know before we go into more detail about inductions is about something called cervical ripening. So before your cervix can dilate and open up, it needs to soften and thin or efface, which means that if you're being induced and your cervix has not ripened yet, it's not become thin or soft, your care provider might have to ripen the cervix using some tools or medication. So there are several ways that they can do that to ripen the cervix before they start the official process of starting your contractions. So most people who are induced, but not all, need two steps in the process. Most people need to have their cervix ripened, and that means that they're thinning and softening the cervix either with drugs or mechanical methods. Sometimes that cervical ripening is all you need and your body just naturally goes into labor once your cervix is ripe. But most people will need something extra to get the contraction started. They'll need that second step. So they'll have cervical ripening first and then a medication to induce contractions. Now, let's talk about the physical methods first, those mechanical methods. Like I said earlier, these methods have fewer side effects, but they're typically less effective. One common mechanical method of labor induction is called membrane sweeping or membrane stripping. This is typically done in the doctor's office it has to happen during a vaginal exam. And how this works is the provider will take their finger, their gloved hand, and during the vaginal exam, they're going up to the cervix, which is at the top of the vagina. And the cervix has to be open enough for this to work. So we've talked about cervical dilation. So if the cervix is closed, they can't get their finger through. You can't do membrane sweeping. But if the cervix is dilated enough where they can get their finger through the hole of your cervix opening, what they're doing is they're going to take their finger and sweep around. This is also called stripping the membranes from side to side. And what they're doing is they are separating the sac of membranes from the cervix. And what this does is that it releases prostaglandin hormones that can trigger labor. The benefit of having this done is that you're less likely to need medications to induce your labor. And it shortens pregnancies by about 4 days on average. So if maybe your body was going to go into labor on its own at 40 weeks and 4 days, maybe it'll go into labor at 40 weeks and 0 days instead. However, the risks are that this procedure can be very painful. Most people report a lot of pain with the procedure, and there's a 1 in 10 chance that your water might accidentally break as a result of this procedure, which would then cause PROM, which might then require a medical labor induction. Another problem with this procedure is that it can cause your uterus to become quite irritable and keep you awake, cramping over the next few nights, leading to a loss of sleep. Membrane sweeping is an option to help get things started, but it's not that effective and it's painful. It's really up to you if you want to use it or not. Keep in mind that some providers, as a standard procedure, do membrane sweeping at term with all of their clients. So it's always good to ask before you have any kind of vaginal or cervical exam at the end of pregnancy, and make sure that they're not going to sweep your membranes without your permission, because some care providers think that this is just part of the vaginal exam when it's actually a separate part. Another example of a tool that's used to induce labor is an Amni hook. An Amni hook looks like a crochet hook, and this is an actual Amni hook. It's a plastic stick with a little hook on the end, and if you touch it, it's actually quite sharp. So care providers use this during a vaginal exam. They'll insert this up to your amniotic sac, and they use this to puncture the amniotic sac and release your waters or break your waters artificially, which in some people can start labor. Now, again, you have to be already a little bit dilated in order for this to work, because they have to be able to get the amnio hook through your cervix to the amniotic sac. So if this is your second or third or fourth baby, this might be all you need to medically induce your labor. However, when it's used alone by itself without any other measures, the amnio hook might not be as effective. So with a first baby, it's not effective by itself. It typically has to be combined with medications in order to be effective. Another thing I wanted to show you is that you don't just need a long plastic stick to break your water. Care providers can also put a little, it almost looks like a little finger condom on top of their glove, and they roll this down. And when they're doing a vaginal exam, this little finger glove will have a little sharp hook on the end. So it is possible for them to insert their finger through your cervix and break your water with their finger wearing this little glove. Now, the main risk or drawback of amniotomy, which is the medical term for breaking your water, is infection, especially if they break your water and it takes a long time for your baby to be born. Once those membranes have been broken, it's more likely for infection to bacteria to be able to travel up into the uterus. And the other problem with breaking your water is once you break your water with the amnio hook, you can't take it back. So you can't undo it. You've set things down a path that now the baby has to be born. So that's the main benefit, I guess, of this is that if, again, it's used in combination with medications, it can be effective. We'll talk more about that in a minute. Also, it's not going to be that painful. So that's a benefit. A third tool that can be used to induce labor is the Foley catheter. This is sterile tubing. We talked about it with interventions. It's usually used to catheterize your bladder, but they can also use it to ripen your cervix. So how they do this is during a vaginal exam, they insert this up the vagina and through the cervix. So it's gonna, again, your cervix has to be dilated enough to be able to get this through. So at least 1 centimeter dilated. And once they get it up into your uterus, they will use saline and inject saline to create a balloon at the top of the catheter. So imagine this catheter is now hanging out inside your uterus just above your cervix. And now we've got a balloon kind of hanging out up in there. And so they'll pull down, and that balloon just puts a little bit of pressure from above on your cervix. And then once your cervix opens and ripens, the balloon can just fall out. So typically it'll fall out when you're about 4 centimeters dilated. So you can get to about 4 centimeters dilation with this. Sometimes that will even start some contractions on its own as well. But usually after the balloon falls out, then they know your cervix is ripe and they can start medications to continue your induction. So the benefits of the Foley balloon are that it's pretty effective and it doesn't carry side effects like you would see with medications to ripen the cervix or to start labor. The main risk is that it can be uncomfortable or painful to insert the uninflated balloon up into your cervix. just kind of like how a membrane sweeping might be painful. But once your cervix is dilated, it just falls right out. So it doesn't hurt when it comes out. It just hurts kind of during the exam when they're inserting it. So those are some physical tools that we can use to physically ripen the cervix or start labor. So next, let's talk about how medications can be used to ripen the cervix or start labor. So synthetic oxytocin is an artificial hormone that mimics your natural oxytocin. It's also called syntocinon in some countries. In the United States, it's typically called Pitocin or PIT. With a Pitocin induction, an IV pump is used to infuse Pitocin into an IV on your arm, so it goes directly into your bloodstream. The main benefit with Pitocin is that when it's combined with breaking your water with an amnio hook, this combination is the most effective medical labor induction method at getting a baby to be born vaginally in the next 24 hours. So combining Pitocin with breaking your water is considered the most effective form of a labor induction. The main risks, though, of Pitocin are that your uterus might react too strongly to the medication. If your uterus contracts too frequently or too strongly, that can stress your baby because the baby can't get enough oxygen if the uterus is contracting too frequently or too strongly. If this happens, they typically turn the medication down or turn it off for a little while. Good thing is when they turn Pitocin off, it leaves your system very quickly. Now, because there is this risk of Pitocin of causing stress to the baby, most people who are induced with Pitocin will have to wear a continuous electronic fetal monitor, which can be uncomfortable and might limit your ability to move around, which might mean that you end up staying in bed. So a good idea might be to ask for a mobile monitor if you have to be monitored with Pitocin. Also, it's pretty common that when people get Pitocin, they often decide to have an epidural. There is some research showing that Pitocin-induced contractions are more painful than contractions caused by your own natural oxytocin. That's because when your own oxytocin creates contractions or waves, it's also in your brain helping manage pain, whereas Pitocin, when it's given through an IV, doesn't cross the blood-brain barrier, so it can't help simultaneously with managing your comfort. Another risk of Pitocin, or really with any induction method, is that it might not work to successfully induce your labor. With all of these methods, if your body is not ready, it's possible that the use of these methods could lead to what they call a, quote, failed induction, which then leads to a cesarean. Now, one of the things that's going on with your body leading up to spontaneous labor, we talked about this in the orientation videos, is that little hormone receptors are popping up all over the uterus as you get closer to spontaneous labor. If you give someone artificial oxytocin or Pitocin too early in pregnancy through the bloodstream, and these little receptors are not there, they haven't popped up yet, then there's nothing for the Pitocin to latch on to, and so you won't get effective labor contractions. So we've talked about Pitocin. The other drug method that can be used to induce labor are prostaglandins. Prostaglandins are used both to ripen the cervix, and sometimes they can also induce labor contractions as well. There are two main types of prostaglandins used. So prostaglandins is a hormone, and the ones that are used to help with the birthing process are prostaglandin E1 and prostaglandin E2. So let's start by talking about prostaglandin E2, because this is the type that is FDA approved in the United States. Prostaglandin E2 is also known as Cervidil or Prepidil. These drugs are FDA approved to help ripen your cervix to start the birthing process. It's often given starting in the night times. They might give it to you like around midnight. So you come in late at night and they give you the Cervidil or Prepidil with the goal of ripening your cervix overnight so that then they can start IV oxytocin or Pitocin in the morning. So this is a sample of Cervidil. Cervidil has been found to be very effective at ripening the cervix in clinical trials, and it also decreases your chance of ending up with a failed induction or a cesarean. So in this Cervidil packet, when they open it up, it looks like a little string. The medication is kind of in here at the tip of the string. And so the provider would take their gloved hand and insert this close to the cervix, and the medication would release around the cervix, and then you have the string kind of hanging out like a tampon string so that you can pull it out when it needs to be pulled out. The main risk with Cervidil or Prepidil is the risk of the uterus contracting too frequently, causing stress to the baby. The higher the dose that's used, the more likely this problem is to occur. Also, this drug is incredibly expensive. It costs around the range anywhere from $700 to $1,000 for one dose. And because it's expensive and because it has to be refrigerated, hospitals don't like to use this as often. For example, if you live in the United States with our lovely healthcare system, if your hospital is only getting reimbursed one flat fee from your insurance, they might not want to use Cervidil, even though it's really effective, because of the high cost. They'll lose money on you if they use this drug on you. This is not going to be reimbursed by your insurance if your insurance is just paying a flat fee for your care. So it causes them to lose money, the hospital. So although this drug is more expensive, it's considered to be quite safe, and it's FDA approved, unlike another drug I'm going to talk about. The other prostaglandin that is used to ripen the cervix is called misoprostol. It's also known as Cytotec. This is a prostaglandin hormone of prostaglandin E1. It's not FDA approved in the United States for labor induction, although it is recommended by the World Health Organization for labor induction. Cytotec it's a pill, and it's a stomach ulcer drug that is sometimes used to cause abortions or terminate pregnancies because it's very effective at causing contractions and causing the uterus to empty out its contents. Although there is a ton of research on Cytotec, it's still not FDA approved for use with labor induction. And that's because there's really no financial incentive for drug companies to spend millions and millions of dollars to get FDA approval because it's already being used all around the world, and it's so cheap of a drug, it only costs pennies, that drug companies won't make any money on it. So there's been no money invested in getting FDA approval for this medication. So when doctors use misoprostol or Cytotec for cervical ripening and induction, it's being used in what we call off-label. This means that providers are prescribing it and using it, even though it's not FDA approved for this purpose. This is something that is legal for care providers to do, but there are some safeguards we don't have when a drug is being used off-label. So misoprostol is a little pill that can be taken by mouth or it can be inserted into the vagina. Giving misoprostol by mouth, swallowing the pill is actually preferred over inserting it into the vagina because research shows it's less likely to overstimulate your uterus when it's given by mouth. One of the problems with misoprostol is it was not designed for use for cervical ripening. So sometimes they have to cut the pill or try and score it to get the right dose. So the dosing in the whole pill is not what you need. They have to kind of cut it to try and get it to the right size. So remember earlier when I talked about how drugs that can induce labor can cause your uterus to contract too frequently and too strongly, decreasing oxygen to the baby? That's a risk of using any medication to induce labor, and this is a well-known side effect of misoprostol. So it's more likely to happen to you if you've taken misoprostol vaginally or if you've been given high doses or doses that were too close together. Now, with oxytocin, that goes through your arm in an IV. One of the benefits of oxytocin is that we can turn it off if it makes your uterus contract too much. One of the problems with misoprostol is that you can't take it back. Once you insert the tablet in your vagina or you swallow it, if your uterus does overreact to the drug, they can't delete that and make that they can't undo it. Whereas with the Pitocin drip, they can turn off the Pitocin. The Pitocin very quickly leaves your system. So in order to lessen the risk of your uterus contracting too much, when providers do use this drug, they should be using the lowest dose possible. They should be using the oral dose, you'd be taking it by mouth, and waiting at least 4 hours after the last dose before starting anything like Pitocin. Because misoprostol or Cytotec is being used off-label and it's not FDA approved, providers are not required to report life-threatening side effects. So although there has been a lot of research on misoprostol or Cytotec, we still need more research to learn about its safety. And consumers in the United States have been petitioning the FDA to do a big study on the safety of misoprostol, but we don't have that information yet. So you might be wondering, why are providers using misoprostol even though it's not FDA approved? Well, research shows that misoprostol or Cytotec is a very effective way of getting an induction done quickly and promoting a vaginal birth. So you're more likely to have a vaginal birth and less likely to have a cesarean with Cytotec. It's also super cheap. It just costs several pennies and it does not need to be refrigerated. So it's very easy to administer. So now we've talked about all the different methods of a medical labor induction, the mechanical methods, and the medications that might be used. Up next, you're going to learn some tips and tricks for a medical labor induction.